Hi, I'm the Happy Hygienist. So in this video, I'm going to give you a little walkthrough of what you can expect when you're visiting the dental practice since the Covid-19 pandemic. So from the moment you call, to when you arrive, to being in the surgery and then leaving. I'm just going to give you a little walkthrough so you know exactly what to expect. At the moment, we're in the process of returning to face-to-face treatments because during the pandemic, we were only able to offer triage over the phone or referral to urgent dental centres where needed. But now we are slowly starting to see patients face-to-face, but only for emergency treatments currently. That is changing all the time. So when you watch this, that might have already changed. I'm going to pop in the description below a link to the NHS Dentistry guidelines so that you can keep an eye on that so that you know exactly what we're offering at this time. Also, I will keep you updated. So subscribe me. Click the little bell so that you get my notifications so that you don't miss anything. If you're in any pain, please do call your practice, even if you think they might be closed. It's likely that the doors will be closed so that you may not think there's anybody there, but if you call, there's a good chance that there is somebody there who's able to assist you. So do give it a go. If there isn't anyone available, then try 111 and they will point you in the direction of a local practice who can help you. When you call, you will first be triaged by a dentist. They will do their best to treat you over the phone if possible. They may refer you to an urgent dental centre if they feel necessary. But if they decide that you ought to come in, you'll be handed over to a lovely receptionist who will perform a risk assessment of you. Unfortunately, this does mean she'll be asking a lot more questions than usual regarding your health and your history of COVID-19. So please don't think she's prying. She's just being nosy. Unfortunately, it's just something that we have to do to keep everybody safe. The receptionist will also run through some of the new procedures with you so that you know what will be expected of you when you arrive and what you can expect of us when you arrive, as well as offering you the chance to pay over the phone. If you are able to pay over the phone, it is a good idea to do so just because it reduces any exposure. When you come into the practice, it means you don't have to be face to face with the receptionist and touch things, etc. If you are unable to pay over the phone, you will still be expected to pay on arrival, so before you have your treatment, in order to reduce how many people we have in the practice at any one time. So you'll pay on your way in instead of on your way out so that you don't have to pass anybody, and again, minimising any exposure. And currently, the cost of urgent NHS treatment is £22.70. So that's what you can expect to pay if you're coming in for an urgent NHS appointment. Now, if you or any member of your household is displaying symptoms 1 hour prior to your appointment, please call and cancel your appointment. Please do not take the risk. You will not be charged for cancelling your appointment. You will not be penalised for cancelling your appointment. We will get you back in as soon as we possibly can. But if you are unwell, or of course if you or anyone in your household has tested positive for COVID-19, please be responsible. Please do not come to your appointment until everybody is fit and well and better again. In order to prevent people from crossing over within the practice, we're currently staggering appointments, which means it is more important than ever that you are punctual for your appointments. If you arrive early, you will be asked to wait outside, a safe distance away from the practice, in your car preferably, if you came by car. And if you arrive late, unfortunately, you will probably not be seen. So please try to be punctual. When you arrive, the doors will be locked. So you will need to call the practice to let us know that you're there. You will then be greeted at the door by a lovely nurse wearing full PPE. So, they'll have the gloves, the mask, the visor, the apron, all of it. She or he will then hand you a face mask and ask you to wear it whilst you're walking around the practice and lead you to a hand sanitizing station where you will also have your temperature taken. Now, anybody who is attending with a carer, a parent or a guardian will also be asked to wear a face mask, sanitize your hands, and will also have their temperature taken, just so you're aware. Nobody else will unfortunately be admitted into the practice. So anybody who does not have the need of a carer, parent or guardian, unfortunately you must come alone to your appointments. Now, when we take your temperature, if it is above 37.8 degrees C, you might not be seen. The dentist will either ask you to go home and isolate for 7 days just to be on the safe side, and then we'll book you in again as soon as possible. Or they may refer you to an urgent dental centre if the treatment that you require is urgent and cannot wait 7 days, because these dental centres, they're just better equipped to take care of you if you're displaying symptoms of COVID, such as a temperature. But if your temperature is below 37.8 degrees C, then you'll be led to the surgery. So when you arrive in surgery, your dentist and dental nurse will be heavily clad in PPE already, so don't be alarmed, and they are in there somewhere, I promise. Also, we're no longer allowed to use fans or air conditioning units within the surgeries just because of, recirculating air and things like that. All available windows will be open for ventilation, but if you know that you get sweaty when you're nervous, or if it's a particularly warm day, I recommend you dress light because it could potentially get quite warm in the surgery. Your dentist will have more questions for you than usual regarding your health and history of COVID and things like that. So I'm really sorry, please just bear with us. It's these things that we have to do in order to keep everybody safe. And as I mentioned earlier, currently dentists are only able to provide emergency treatments. So treatments just to get you out of pain, but these things are changing, so keep an eye on that. So once you finish your treatment, the lovely nurse that took your temperature earlier will come back to the surgery to collect you. He or she will then lead you to another hand sanitizing station. You'll be asked to clean your hands and then you are free to go. Don't be confused if they lead you to a different exit to the one you're used to. Most practices who have this facility will be doing that. It's just in order to create a one-way flow of traffic, as it were, to prevent people crossing over. So the nurse isn't lost. It's just taking you a different way this time. So that's it. I hope you found this useful. I'm the sort of person who gets a bit anxious about the unknown, so I would have found it useful. And I am sorry that I couldn't, take you for an actual walk around the practice or show you my PPE or anything, but unfortunately none of my practices are having their dental hygienists back just yet. But when I do go back, I'll be sure to take my camera and give you a little walk around. So I hope that this helps you to understand a little bit more about the new normal, as it were. And like I said, I will keep you up to date. So please subscribe me. Please take care, stay safe. And until I see you next time, keep smiling.